Hi, my name is Lorne Brown, and I'm with Dr. Robyn Murphy from DNA Labs. She's a naturopathic physician and consultant at DNA Labs. We've had lots of opportunities to chat. And Robyn, I want to just talk more about the genetic testing and screening that you are doing and that we're using in our clinic, because there's a lot of testing that's out in the public. And I want to learn more for our patients' sake, kind of what you guys are doing. So can you kind of start with just the difference between what you're doing and the other testing that's out there, please?
The first thing to understand about genetic testing is there's multiple platforms for genetic testing. So there's genetic testing that's done, say, with your medical doctor or at a hospital, and this would be for more disease-based genetic testing, or it could be for fertility, for chromosomal errors. And then there's this whole branch of what's called lifestyle genomics or nutritional genomics, nutrigenomics. And this is where we're starting to look at different areas within the genes that are affecting how we respond to kind of lifestyle interventions. So things like your diet, your nutrition, hormones and detoxification. And we know that a lot of these pathways contribute to the development of disease. And more importantly, when we start to identify individual nuances within this genetic pathway, we can start to then individualize recommendations. So this is all part of a personalized medicine approach where it's predictive as well as geared towards the individual. Unless you know kind of the genetic information of where people are starting from, some of those nuances of how they're kind of reacting to their environment, it can be very difficult to know kind of where to look as a clinician, to know kind of where to get the biggest impact for your strategies for treatment.
And we really have been excited about introducing the DNA lab testing into our practice at Acubalance. We started in early 2019 because we're really well known for what we call our health audit or our fertility audit. So I used to be CPA before a doctor of Chinese medicine and functional medicine. So I like to dig for the underlying cause. And you mentioned this with the genetic testing. It helps it become more personalized. And the whole tenets of Chinese medicine, naturopathic medicine, and functional medicine is treat the individual, not the disease, right? Don't treat the symptoms. And we love this test because now it's going to give us some predictive information. We can see where somebody may have issues later on in life or currently in life. And again, how they can do certain lifestyle interventions. So how they exercise, their diet, what they eat, and how that can influence genes. Can you talk a little bit more about what you guys are seeing clinically?
So when we look at DNA Labs and the panel that we're running right now, we break it down into 8 different sections. So we're looking at diet, how people actually respond to different foods, macronutrients, are there risks for insulin resistance, how they're responding to, say, the Mediterranean diet for cholesterol levels. We're also looking at sensitivities, so looking at lactose intolerance. Is there a gluten sensitivity? We know that gluten within itself has a massive range of impact on the human body. Whether you're celiac or not, we're finding that that can contribute to disease. So knowing what your potential risk is for celiac and non-celiac is really important to understand, because we also know that if you are a carrier of those genes, it can also increase risk for other things like mold toxicity as well as Lyme infection. We also look at detoxification, so glutathione, how you're processing different chemicals, the risk for what's called intermediate metabolites, which increases risk for DNA damage. So this is what contributes long-term to say something like cancer. But when we look at it from a clinical standpoint, we're wanting to see what is the total burden that the body is under. And especially considering how many environmental toxins are present, that burden is becoming more and more enduring for people. So just understanding individual nuances when it comes to how effectively people are clearing some of those chemicals and how those may be contributing to diseases as well. And that plays into hormone regulation as well, hormone metabolism, which is another area that we look at, as well as looking at things like physical fitness. But really, when you get into the nitty-gritty of it, it's really about repair and oxidative balance. So how well are you able to respond to an increase in energy demand, any risk for particular injuries, as well as looking at risk for nutrient deficiencies. And some of these nutrients, we take for granted that the food that we're eating, we're breaking it down, we're metabolizing it, absorbing it, and getting the appropriate levels to ensure that we're optimizing our overall health and function. But that's just not the case. Certain individuals need more of certain vitamins and minerals. And we also know that if you're under, certain states of health, whether it's pregnancy, whether it's a disease, then those demands will increase. And so this is a way to help identify who is susceptible at what stage and what the treatments are going to be kind of in a lifetime or in someone's, that particular point in their life to really utilize and start shifting things. So in clinic, we use this as almost like a screening tool to help us to be able to understand what could be the underlying factors that are contributing to someone's health, what's preventing them from achieving some of their health goals. And this could be across many different, demographics. It's not just for people who are sick and unhealthy. It's also for people who are looking to optimize pregnancy or looking to prevent disease because there's a family history. And then when you look at it from an epigenetic standpoint, you're absolutely right. There's there's balance between nurture and nature. And so the nature is really our genetic code. It's our blueprint. It's kind of the information that all of our cells are using on what to make, how to function, and how to respond to the environment. And the nurture part is the environment. So what are the environmental triggers, the cues that we're taking in and putting into our body that our cells are responding to? And more importantly, what I see clinically is when people have objective data saying, for example, that there's a pathway in their detoxification that has a massive effect on their antioxidant status, their ability to repair, then they're more likely to follow that advice long term if they know that this one thing, this one area is going to help them specifically.
And I'll use myself as an example. So through your test, so Dr. Ashley Dam and Kaylee McCausey Acubalance are my physicians. They're the ones taking care of me. And so we run some testing. And in my DNA, I am an inflammation maker. So I have some poor methylation. So we know there's some inflammation issues. I have family history of cardiovascular disease. However, my DNA testing tells me I got the good arteries, the Teflon arteries. So the inflammation is probably not going to impact my heart so much, but it can impact elsewhere. As we talked about the epigenetics, what genes can I turn off or turn on through my diet, through my exercise? And having this test has motivated me because I see the risk factors. I want to be clear. It doesn't mean this is your destination. It's not like I have brown eyes. That's the code. I can't change that. But certain things you can turn on and off based on the environment, as you mentioned, diet and lifestyle. And this is all coming from this DNA report. We're using the DNA report to show what my risk factors are. And then we're testing those things to see, have I manifested what this lab test is showing that I'm predisposed to? And it's acting as a motivation. So for our patients in general as well, it's allowing us to be individualized. And as I said, an ounce of prevention is worth more than a pound of cure. So you mentioned, because I'm going to lead into this. This was just sharing you how we're using this in our clinic. We're really been excited. So I've been excited for myself, and now we're doing this for our patients. We do this test. We use other testing, like we look at the gut microbiome. We do look at urinary metabolites as well. We're just looking at this. This is another tool, as you call screening. And this one is such a valuable one to us to see what people are predisposed to. You're coming to the Integrated Fertility Symposium. You're going to talk about genetic testing, and a lot of it's going to be on women's health. I see this as a really amazing screening for women because we have women come to us saying, I'm in menopause and I would do HRT, but I'm afraid because of the research. Or I just know when I do birth control pill, I don't feel great. So these women don't have serious diseases. They have ovulatory disorders. They have infertility. They have spotting. how are you seeing this test and the extra SNPs you started to look at as the predictive value and helping the clinicians using the test in their practice for hormonal health, women's health, predicting how they're going to respond to HRT or birth control pill, what you can do if you know certain things that they can do to help optimize their effect of those medicines if they choose to do that?
Well, there's, certain parts of the genetic testing that can be really specific for women. And when we look at it, we can kind of break it down into a few different sections. We can look at overall detoxification. How are they processing any sort of metabolites, any sort of drugs or exogenous hormones or, say, endocrine disruptors that they're being exposed to. We look at nutrients and specifically, things like choline that we wouldn't normally think of. Choline is actually the enzyme in order to make choline internally is directed by estrogen. So as women age and the estrogen levels decrease, that signaling to help to produce choline can decrease as well. And this is something that we wouldn't normally think of when we look at, say, a woman's health going into into menopause. And then finally, we can look at kind of estrogen metabolism. So estrogen metabolism, as the estrogen is being deactivated and broken down, what we're starting to see in the research and starting to understand is how the estrogen is being broken down, and these different metabolites and their ratios can have an effect both locally within reproductive tissue, within the breast tissue, within the ovary, even within the endometrium. And this can have effects on local levels of DNA damage and what's called reactive oxygen production. And so this is what we're starting to understand from a predictive value as to why certain women overall lifetime exposure to estrogen can be more damaging to some than others. So it has to do with how the estrogen is being broken down. If women are funneling into a pathway called 4-hydroxyestrogen, this can, what we've seen in studies is that this can increase local production of DNA damage and has been thought to contribute to the onset of breast carcinogenesis, so the development of breast cancer. Now, in labs, we're looking at these ratios in urinary levels. So this is the 2-hydroxy to 16-alpha-hydroxy levels. So these are, again, different metabolites of estrogen, which clinically we believe is associated with local levels. But this is our best guess from a clinical standpoint. We still don't have the precision to understand how this is affecting the local tissue environment. So the breast health, the endometrial health, we're kind of giving an overview. And so with the genetics, we can, this is another piece of the puzzle. We can not only use the urinary metabolites for women who are on, birth control or taking hormone replacement therapy. We can see how that's showing up in the urine, but we can also understand genetically how are they predisposed to breaking down these estrogens. And more importantly, what can we do in order to shift those ratios and shift the likelihood of DNA damage that could contribute to ill health. So what's interesting with the genetics is when we look at studies, you'll see some of these genes will relate to breast cancer. And when we look at hormone replacement therapy, right now the results are actually quite conflicting. But the best study that I've seen is one that was done for a 10-year period. And so they kind of have an understanding that certain women, if they're funneling the estrogen down certain pathways, it may be the timing, so how long they're being exposed to these exogenous hormones that may be having an impact on their risk for development. So that can give us clinical information. We can help to guide patients on the timing of looking at, the duration of how long they should or consider using hormone replacement therapy, say during the perimenopausal years, to help reduce some of those symptoms, but also look at some of the natural treatments. look at some of the things like cruciferous vegetables or the extracts like sulforaphane, and how those can be used to help drive the proper estrogen production. And this has been discovered through studies looking at genetic expression and how those become modulated.
And this is, again, using this as a screening, because not everything is evidence-based yet or diagnostic. And rather than when somebody comes in and says, I'm scared about HRT, or I'm scared about taking the birth control pill, rather than just making a guess or the general stat or the general population, this is what we say, this allows us to become individualized again. And so now we're just having, it's not definitive, but now we have even more information to be predictive and to counsel them and coach them for the best option for them based on what they have, as you said, in their detoxification pathways, for example. Mm-hmm. Ashley, I just wanted to check in with you as well, because in our clinic, with the DNA labs, there's the version that's out there for the public, and there's clinicians where we get some extra snips, and Dr. Ashley Dan takes that and summarizes that more with your report. How are you finding this in your clinical practice in driving some of your treatments, and how are you using this with women with reproductive health?
I'm finding it really valuable I think it's an awesome tool to take the patient's clinical symptoms and picture, and then have this as an added tool where we can look specifically at certain SNPs and kind of map out the pathway to see where there are possible imbalances that maybe weren't on our radar initially, and then target our treatment specifically to that. It's also really wonderful to show the patients what's kind of going on based on their genes. It's really empowering in my experience, sharing this information with them. And it can be really motivating to add on some of the more lifestyle changes that help with the epigenetic side of it, where that might be diet or certain supplementation. So in that way, it's been useful to really tailor it to what's going on for the patient.
Again, it becomes that individualized medicine. Just going back from some of the conditions that clinicians are using, the public are using. So you mentioned, for example, you don't need to be sick. This is the new paradigm, as in, let's not be sick, let's be healthy and vital, right? And so athletes are using this to help them know how to train and eat, and also risk for injury, I understand. People that are listening to this, watching this, how they can use this tool to maintain their health and even see if they can get healthier. And if people are experiencing poor health, how this test could help them reverse some of the disease process they're experiencing.
Yeah, so kind of a high level, when we look at certain lifestyle chronic diseases, in general, we look at diabetes, risk for insulin resistance. We look at risk for high triglycerides and high cholesterol, as well as something called hemochromatosis, which is iron overload, as well as iron deficiency. We're looking at risk for celiac disease as well. And as I mentioned, celiac disease is, it's not just about being celiac disease, but non-celiac gluten sensitivity, which has a broad impact on a number of different pathologies and diseases. So when we look at other factors like the other sections like detoxification, there's specific genes related to glutathione that impact overall oxidative stress, as well as risk for things like cardiovascular disease. It can be extrapolated into kind of long-term inflammation risk, which we know has a number of different impacts on, say, neurological health, risk for dementia, infertility, endometriosis, and so on. So quite a number of different chronic diseases. And then when we look at the hormone side, definitely risk and predictive value for endometriosis. So that's related to glutathione pathways. We're also seeing associations with things like fibroids, PCOS is a big one as well, especially when you look at insulin resistance and some of the pathways related to how estrogens and the androgens are being broken down. and their influence on follicular development. And then generally infertility, risk for recurrent pregnancy loss, which can be obviously very difficult for women who have gone through. And that, interestingly, is related to caffeine consumption. So just, again, starting to individualize some of these lifestyle nuances that can directly impact risk for some of these diseases. When we look at other sections, we're also looking at obesity risk. So not only what is the risk for weight gain, but what are those contributing factors which contribute to weight gain? So for example, tendency for snacking, tendency for overeating, not getting those same signals for satiation, for feeling full after a meal, and that leads to increase in calorie consumption, as well as some of the behavioral cues and hormone cues in order to modify weight loss strategies. So that's kind of a good overview of what we're looking at.
Using the genetic testing for women in particular, fibroids and endometriosis, can you go into a little detail of what you guys are looking at and sharing with clinicians so they can let women know if they're predisposed, or explain why they may be experiencing endometriosis, fibroids, and more importantly, some of the natural approaches to change the epigenetics, turn on and off genes, so they can hopefully reverse those disease processes.
Mm-hmm. So what we see in a predictive value for genetics related to fibroids in particular, it has to do with how the estrogen is being broken down. And interestingly, it has to do with one of the pathways that increase the 2-hydroxyestrogen. This is what we consider a beneficial estrogen. But what's interesting is that this gene also metabolizes environmental toxins. So depending on a woman's exposure to certain environmental toxins and how she's breaking those down through particular pathways can increase risk for oxidative stress, and we see an association there with fibroids. So this helps us to target more of the environmental toxin, avoiding certain chemicals, as well as helping to reduce estrogen accumulation and reduce oxidative stress within the reproductive system. And then we also see similarly with risk for endometriosis, except related to detoxification, it has to do with more of the glutathione pathway. So what is the body's capacity to be able to remove some of these chemicals, more solvents, heavy metals that are found within the environment, using glutathione and helping to reduce the oxidative stress. So focusing more on things like N-acetylcysteine, again with the broccolis, or broccoli extracts, sulforaphanes can be highly helpful. But what's interesting is if we start to pinpoint certain women who are missing some of the genes in this area, then they actually don't do, we want to be careful about how much glutathione we use with them. So rather than overloading their system with, say, IV or intravenous glutathione, there's a balance that we want to maintain, because we can see that there is a risk for disrupting this finite, what's called redox balance between the oxidative stress and the antioxidants. And the body, it's very intelligent. So these oxidants that are found within the body are also cellular signaling molecules. So we don't want to disrupt that natural balance as well. So again, it kind of helps us to individualize these treatments and navigate what the overall protocol looks like.
And again, it comes back to individualized medicine, because when we do this genetic testing, because as you know, we'll use IVs or glutathione in a lot of the population, but that small percentage that doesn't do good at conversion, then we know it becomes individualized. Even though for the majority of people, they're beneficial from this, it's benefiting them, this very small population. So again, this test just allows us to have that individualized care for our patients versus this is the average population, so we'll do this for you. So rather than saying take all these supplements, eat all these food, we can really narrow it down. So laser light, and here's 3 things that I want you to take because we know it's going to help with turning on or off genes. When it comes to infertility, where do you see the screening to help clinicians and then the public optimize their fertility? So can you give an overview of how you're seeing the future of how women that are going to go through IVF and they're going to be primed with estrogens or take testosterone, just how this is going to help clinicians as more and more of them adopt this testing?
When it comes to lifestyle genetics and fertility, this is an area that's really exploding. And in the next 5 years, I believe that any fertility clinic is going to be utilizing some sort of testing related to this in order to help with that predictive value. Because what we understand is that pathways related to oxidative stress, related to mitochondrial function, related to detoxification, hormone metabolism, as well as hormone signaling, all influence infertility, as well as risk for certain diseases that can impact risk for, say, early pregnancy loss or poor egg quality or even sperm quality. So a big piece of that has to do with, as you mentioned, detoxification. The studies are quite, we see more studies with sperm than we do with eggs, and that's for an obvious reason as far as it's easy to sample. But what we're seeing very dramatically from month to month, you know, when you look at samples that are being done, if there are certain pathways related to, say, glutathione or superoxide dismutase within the mitochondria, even the cytochrome enzymes and how what we would think estrogen is going through, but other chemicals, we can see how dramatically those can influence sperm quality levels. And when you introduce certain natural remedies that we know directly impact these pathways, you can then see how those sperm numbers jump back up. So we have pretty exciting data showing how these genes are affecting outcome, and then how the treatments are then affecting the outcome based on these pathways as well.
And at Acubalance, we're famous for our fertility audit, and that's why this is the DNA lab is one of those tests we have as part of the fertility audit, because when women come to us, and men, they want to know the underlying cause. Why am I not getting pregnant? Why am I miscarrying? I'm either unexplained, or they say it's because I'm 40. And we know not all 40-year-olds are equal, and there are women who are 40 that are having healthy babies. So it allows us to look for these underlying causes and then look at certain pathways that are under functioning, to put it in a general term, and then what can we do to support the body's detoxification process, get the antioxidants that they need, things that can help maximize egg quality to bring on more hormonal balance. So really excited about the test. And in our clinic, we love the fact that you've given us extra SNPs so we can bring that into our screening as well for our patients.
And I'll just add there, Lauren, there's a few areas that we look at related to diabetes as well as to high blood pressure, that there's studies also showing the impact of gestational hypertension and risk for gestational diabetes. So again, this can not only help with the treatment of fertility, but also of healthy pregnancies, and understanding what could be the risks that we want to work a little bit harder in order to prevent.
And again, to remind listeners, there are lifestyles, there's gentle, non-invasive interventions that you can do to work into your advantage to change how your genes are expressed, which is why this testing is valuable. It's because if it's just like, yeah, you got brown eyes or you got Huntington's disease, that kind of genetic testing, which is not what you're doing, there's not a lot we can do for that. But you are talking about more like lifestyle and the epigenetics. So what can you do now that you know what you're predisposed to? It allows us at our clinic to know what else to test that may not have been obvious to test. So we see that you are predisposed, you're at risk of, doesn't mean you have to have it or you will get it, just risk of. And now we can do further testing, conventionally and functional medicine testing, see if you are manifesting that. And then I know it's been my experience in our patients, it really motivates them now that they can see where they're predisposed. And so they change the way they eat or they exercise or live. For example, I'm predisposed based on my genetics, salt-induced hypertension. Easy. I don't put salt on my food because I know I'm the one that would get hypertension most likely from salt. The other person that doesn't have that predisposition, they can salt their food and they're not going to get high blood pressure. But I'm at risk of getting that just because I know from my DNA testing. So it really doesn't mean I avoid salt. There's natural occurring salt in food, but you will not see me put salt on my food. Or if I eat a meal that's been heavily salted at a restaurant, I put it away because I know my predisposition. So I find this testing is it's inspiring and motivating to the individual to take action and to change certain courses of diet, lifestyle, exercise in their life. Robyn, can you comment on MTHFR? This is kind of the one that I think the public knows most about, especially when it comes to women's health, whether they should take folic acid or methylated folate. And it's not as simple as what people were thinking or thought. And I think you guys do a little bit more testing. And I'd like you to just speak on that because a lot of the women we see are taking prenatals and they're wondering which one they need to take and take it from there, I guess. MTHFR.
Yeah, so MTHFR, it's kind of the claim to fame for genetic testing and this type of functional genetic testing. But this MTHFR, this methyl tetrahydrofolate reductase, it's a long enzyme, but this is all part of one of the pathways inside our cells, which is called methylation. And the reason this is so important, it occurs in almost every single one of our cells, is that this is responsible for creating a certain nutrient called SAMe, S-adenosine methionine, but this is providing you can think of it like a vitamin for hundreds of biochemical pathways. So this is important for producing our DNA, for repairing our DNA and RNA, so for proper cellular repair and replication. It's absolutely important for our hormonal health, for our neurotransmitter and mood, for our detoxification, for our energy production. And this is why you're seeing so much literature and so much publicity with this gene, is because you can associate, if there's problems in this pathway, you can associate it with a widespread number of diseases. And so when we look at this pathway overall, it's actually not just about MTHFR. In the body, there's hundreds and hundreds of different enzymes and proteins, and these are all working in concert together. This is like a symphony that's well orchestrated, so that certain genes and certain enzymes are getting turned on and off appropriately to make sure that the body is controlling some of these pathways. And when it comes to methylfolate, the activated forms of folic acid, the activated forms of B12. I agree, it's important to know, these one or two enzymes and how they're functioning, but you really want to take a step back and say, how is this pathway working as a whole? And how can I support this pathway the most similarly that the body would or nature would, in order to help promote proper function? Because we know when it comes to fertility, particularly, it's extremely important that we have our B vitamins, our active folate to prevent neural tube defect, but as well as proper brain production, proper cellular turnover, proper development of the embryo during this rapid replication of cells. It's a high demand for the body. So we want to make sure that the innate pathways that are helping with DNA repair and replication are there, to sustain this optimal growth. And so when we look at this pathway and we see that there's multiple genes and risk factors for, this process not working as well, that's where we can start to say, okay, it's not just about, the high folic acid or the B12 or the active forms of these. We actually want to support this system as a whole using minerals, a number of the B vitamins, and then adding on some more of those active forms. And we're doing it in more of a strategic way based on understanding kind of these nuances within the pathway. Because otherwise we can affect all these other systems too. I mentioned it, it affects detoxification. And if we're ramping up detoxification too quickly without making sure that, the pathways of elimination are open, then we can start to see, side effects, unpredicted or unexpected results that we just want to make sure that we're preventing as well.
What is nutrigenomic and lifestyle genomics, and how does this differ from other genetic testing?
So nutrigenomics is the study of the genes and how those genes are interacting with the environment and how variations in those genes can affect how individuals actually respond to different interventions, different environmental recommendations or lifestyle strategies to ultimately affect disease and how and overall health. When we look at nutrigenetics, it's a little bit of a change in the word there, genomics versus genetics. But genetics is looking at the actual genes and how changes in those genes can affect how we process certain nutrients. Particularly, so if, for example, if you look at iron levels, some individuals, they have an increased risk for iron deficiency. And so this deficiency requires that, or risk for deficiency makes them more susceptible to iron deficiency if their consumption was low overall. We also look at, say, iron overload, meaning that it would be very important for this person to actually avoid iron. And if people are just kind of looking at their overall symptoms generally, they heard that iron might help with their fatigue, they could actually be doing more harm than good in adding in iron into their diet. So the study of nutrigenomics and nutrigenetics is looking at kind of nutrition, diet, lifestyle interventions that can affect gene expression, but also one's susceptibility to their lifestyle choices. So this is different than other genetic tests out there. There's something called pharmacogenomics. So this is looking at how individual genes can change one's response to certain medications or risk for side effects for certain medications. And there's other types of genetic testing looking at, say, chromosomal testing, which we use in fertility, or there's diagnostic genetic testing, which is typically done at the hospital. So this is looking at very specific disease-based genetic ailments.